Hello and welcome to Give and Take, the Positives in Life. And today's topic is cancer support care. And before I get started with the wonderful guest that I have today, I just would like to start by saying that I dedicate this show to my father, Victor Graves, who transitioned his journey on May 19th, 2016. And he was diagnosed with lung cancer a year ago. And I just want to talk about what wonderful care he had from cancer support team. And it was just a wonderful, wonderful care that they gave him. And the way that he left for his transition was just the most wonderful way that anybody could actually die. I mean, it sounds an unusual way to describe it, but he was just so at peace. There was so much love. There was so much happiness, even at the funeral. There was no sorrow. There was just nothing but just upbeatness, everybody being upbeat, everybody having lots of love and peace. And on that day, it was a very auspicious day, the day of the funeral. I got nominated for Best New Series, LMCTV, Best New Series for 2016. And so I got that wonderful award. And as much as I tried not to have that happen on the same day, it's not about what you want, it's about what needs to happen. And so you'll see a picture of me at the award ceremony. Here we go. And it was just one of the most wonderful days that I have to say that I've experienced in my life, and some might get confused by that because of what happened, but it was all the way that it happened so beautifully and so accurately without me trying to change it or try to alter it in any way. And so I want to take this opportunity also to thank LMCTV for the award that I received, and all the staff and the studio, and so thank you. I appreciate that. So now we're going to move on to the topic of cancer support care, and we have a wonderful guest, and she will introduce herself, and so welcome.
Thank you, Cicely. I'm Julie Meade. I'm the Executive Director of Cancer Support Team.
Great. Mm-hmm.
And we are a licensed home care agency that work with cancer patients in Lower Westchester County, and we provide nursing care, social work counseling, case management. We have a transportation assistance program and financial assistance, and all of our services are provided free of charge and without regard to insurance coverage.
Wonderful. And I remember when we heard about it, it was like, it was really just a wonderful, it was just a comfort to know that that was there. And, you know, even when I went to India, you know, I was going to be gone for a while, and I was a little concerned about him, but I was able to speak to the nurse, and Ailish, wonderful. She was so wonderful, and she just, you know, looked out for him while I was not there. And even when she had to take time, she made sure somebody else went in and looked after him. And so there was that ease. And she would send me an email just to let me know, oh, I went by and he's okay and he's doing this. She gave me like a full detail of everything. And so how wonderful.
Yes.
And so just share a little bit the history of how Cancer Support Team came about.
Sure. We were founded in 1978, and our founders were Dr. Arnold Wald, who is a radiation oncologist, and Gail Lee, who is a nurse and patient advocate. And Dr. Wald had a vision, and he realized that his patients that he saw come and go to his office were getting treatment for the tumor, but not necessarily treatment for themselves and the support and compassion that they needed. And so he found Gail, and he partnered with her, and they started Cancer Support Team, and it started no office. They operated out of his oncology practice's office, his radiation practice office, and would go out and visit patients. And it started with just the one nurse, and then they brought on additional staff, and we've grown now to 6 nurses, 3 case managers, and two social workers.
Right.
And we became licensed by the New York State Department of Health in 1982.
Excellent, excellent. So now how long have you been there, Julie?
I've been there since 2009, and I joined as the Director of Finance, and I'm now the Executive Director.
Okay, and I've been up to the offices, and I remember they even sat down and spoke to us about when it does eventually, when something happens, whatever, you know, whenever the transition is made. and we sat down and we spoke about how to, you know, write up the power of attorney, even though we had one previously. And I really implore everybody to make sure that you have a power of attorney in place, because
Yes.
if I didn't, it would have just been like total chaos.
Yes.
Because I even have one for my mother who's in a nursing home. And so it's important to have that. So we sat down and we spoke about the last rites. What do you want? And so that helped at the end as far as knowing what he wanted. Because, you know, when you don't know what a loved one wants,
Right.
it's very difficult. You could be doing something against their wishes, and then that's not a comfortable feeling. So they came to the home, and we sat down, and we wrote it out, and everything was all notarized and sent copies and everything. And so it's like every fine detail was covered.
Yeah. We do a lot of work with that, with all sorts of the support systems and working with the patients and the family. We do serve the entire family. So in areas like that, and the power of attorney, we do living wills, healthcare proxies. We've had a lot of experience with that, and work with other organizations as well in that, and with legal services if that's involved too.
Right. Yeah, so it really did make things, you know, it's just good to be proactive. Some might say, why? Why are you doing this? Why are you doing that? But it's better to be proactive instead of getting stuck with things that you're not going to be able to deal with later on. It's going to be too late.
I think it also gives you a feeling of control.
Right,
Because there's so little that you can control, and knowing that for you as a family member and for your father as the patient, that he's, you know.
Exactly. And so we had the wonderful opportunity of having the oncologist nurse, Ailish McGrath, and she would come by the home, and she brought a wonderful care packet. So talk about that care packet.
I meant to bring it with me, and I
Oh,
forgot.
okay,
I'm very
that's
sad
all
about
right.
that.
Yeah.
It's a chemo comfort kit, and we get those from an organization that we partner with. We're actually their first partner. They are, Chemo Comfort was founded, it's a 501c3 organization as well, and it was founded by Anne-Marie Palucci, who is a cancer survivor.
Right.
And she basically put together a number of items and that she found useful through her journey and her experience with chemo. And it has warm fuzzy socks, and it has ginger tea, which will help with nausea, mints
and ginger sweets.
Right, ginger sweets, some tea tree oil,
And pillowcases. It was
for
silk pillowcases, like for your hair, and a nice cap.
yes, a cap
to put on your
pillows,
head.
like, so
Yes,
the fuzzy socks are a big
right, and the
big draw, and
meditation
then-
CD.
yes.
That my dad used to listen to.
Yeah.
He had a few CDs that I had given him from our practice, because we practiced something called Raj Yoga meditation. But he also used to listen to that and the books, and it was just really.
No, it's a wonderful, wonderful program, and all volunteers run it, and they provide. So the way Chemo Comfort works is they work with partner organizations such as us, and deliver the kits to us free of charge, and then we distribute them to our patients.
Right.
And it really is a wonderful. All of our patients say it's, you know, it's like we
so
brought them a
lovely.
present.
Yeah, it was like, and there's like lotions and different things to address whatever the body was going
Yep.
through
There's
in
special
regards to the treatment.
toothpaste, too.
Special toothpaste, I remember
All
all
sorts of
that.
things.
So it was just, even the simplest, the smallest of things. And I remember there was like a little grant that was given, like a $250 grant, and he used that money to go see my mother for transportation
Right.
and that kind of stuff. And so even that, it was like, wow, like, I mean, they were way above and beyond
Right.
the call of duty.
Well, as Arnold Walds wanted, we basically were trying to support the whole patient, and not just the whole person, and not just the patient.
Right.
And we really do try to help with all the needs, because when you're going through cancer diagnosis and treatment, that takes so much of your attention and your
Right.
energy. And
Right.
for a lot of people, there's a lot of other needs that just can't be addressed. And so to have somebody else help them and hold their hand, so to speak,
Right.
and be there for them is really the
Exactly.
mission.
Exactly. Because Nurse Ailish was very supportive even of the diet and some of the vitamins. She had said, you know, this vitamin is very good because it would help
Right.
with no numbness and stuff. And so she was very supportive of that. She even, like she was saying, you know, do you go to a church? Do you do? And so I mentioned to her, we do Raj Yoga meditation. And she said, so good, that's so good. And I would tell her that we would go upstate to the retreat center up in the Hunter Mountain. And that she encouraged,
Yes.
because she says all those things help. So, I mean, some came to the house and was very, like, I thought they were very rude, they didn't respect what the diet and other things, and they were totally against it. And I had someone be very rude to me. But Eilish was very warm, very sweet, very comforting, and I really appreciated that.
Yeah.
That it just made things, and my dad would always talk about, oh, you know, Eilish, and she's this.
She's
and
wonderful.
Yes.
She's wonderful. I remember when you were away and she was checking in, and then she went away for one point, and
She
we
did.
really are a team. We have, as I said, 6 nurses, and they all cover for each other. So
Right.
while Eilish was your dad's nurse, it was very important that she find somebody and the right nurse to take over when she was gone, to make sure they checked in and could keep in touch with you. And that connection is really very
Connection is
important.
important. And so now let's talk about the drivers.
Okay.
Yes, you want to share about
Sure.
the drivers?
We
and-
have a volunteer program. We have primarily volunteer drivers, but we also have volunteers that'll do errands and friendly visits. And our volunteer driver program is run by one of our administrative assistants, Ginny Ricca, who is phenomenal.
Yes.
And you may recognize the last name
Yes.
because her husband, Peter, was your dad's driver. So we
Right.
provide transportation to and from radiation and chemotherapy appointments primarily in the lower Westchester area, but we will go up to Greenwich, and we do go into the Bronx.
Right.
And patients can call us and request services. You have to be evaluated to be mobile and be able to get in and out of the car by
Right.
yourself, but or with a family member, we can do that. And then we can drive you to your appointments. And our volunteers also develop very, very strong bonds with the patients, and it's a very special thing to see and to hear. We have a volunteer lunch every summer to celebrate our volunteers, and we
great.
try to get a patient there to speak and what they say and what we really provide, so that someone going through treatment doesn't have to rely on taxis or the buses
Right,
or
right.
even friends and family. Even
Yeah.
if you have friends and family, if you're going to
Sure.
radiation every day for a couple weeks, it's a burden.
It was, and that's how I was able to get into touch with cancer support team, because someone from the hospital had made that referral, because I was saying I was working at the time, and so it was like it was a burden for me to, one time I got stuck there, and then I had to run, like race down the road to work from there. I said, this is not going to work, and that's when they did the referral to
Well, and I think
cancer
it's nice
support
for you to
team.
know that it's not that taxi services can't be wonderful and have wonderful
Right,
drivers too, but
sure.
that you have somebody who's there specifically and has worked with patients that are in similar boats as your dad in terms of going through treatment, and really has a calling and wants to do this and be there for patients. So I think it's a great comfort to the family members to know that
Exactly.
that's who's taking their loved one when they can't be there to do it.
And he would share some of the stories of the drivers who actually had cancer themselves and was in remission, and either they had a family member who had cancer, and so he would share with me the stories that they would tell him about. And so it was more than just a picking up, and a relationship happened, and it was just the most beautiful thing that was out there. It really was.
It really is. It really is.
The other thing I wanted to discuss was we have a video clip called Positively, well, it's
Yes.
Positively Ernie, and that's going to show a little bit about what cancer support team does out there. So I
Yes.
guess we'll show that now, Positively Ernie.
Welcome back. You know, on this program, we're looking on the bright side of life, and sometimes that's difficult, especially if you or a loved one is struggling with an illness like cancer. That's why I want to tell you about a wonderful organization in Lower Westchester County, the Cancer Support Team.
Okay, so I'll check your pulse next.
Florence has an important ally in her fight against cancer, a nurse from Cancer Support Team.
Very good.
For over 30 years, they've been helping patients and families in Westchester.
When I go to visit a patient, my goal is not only to support them medically, but emotionally too.
It's for your morale, and that you know there's somebody out there other than your immediate family who can help you.
In addition to professional nursing, the organization offers a wide range of services, such as support groups.
I hear what other people have gone through and what they're dealing with, and I say, oh, I'm dealing with the same thing. I'm not the only one.
There's also individual counseling for patients coping with the disease. as well as for those who have lost loved ones.
This is the first holiday season since Larry's death, and I'm wondering what your thoughts and what your concerns are about that.
Good afternoon, this is Lourdes.
Bilingual staffers offer assistance on a host of issues.
Oh, ¿necesita alguien que le hable en español? ¿Cómo está? Este es Lourdes.
Our staff members are expert in helping people with nursing concerns, with emotional issues related to cancer, and with resource issues when they have a cancer diagnosis.
The cancer support team truly goes the extra mile.
Michael, Peter Ricca. Yeah, I'm here.
Just traveling to treatment can be an expensive hardship, costing hundreds of dollars a month.
Many of them don't have the money to get from point A to point B.
That's one of the ways volunteers like Peter help out.
They're a big support to me, not only in the transportation, but in just supporting me getting through this journey.
Incredibly, all cancer support team services are provided free of charge to anyone in Lower Westchester with a primary diagnosis of cancer.
We do most everything for cancer patients except send them a bill.
Cancer support team has been like a miracle in my life.
Great seeing you. Wonderful to see you, and you're doing so good.
Yeah, thanks. I'll see you next week.
Yes, you will.
And so there we saw it, and we saw Ailish.
Yes.
And we saw Peter, so I was so glad that we spoke about them. We saw both of them on there. So now, how would one go about being a part of cancer support team as far as a volunteer driver or something like that?
We, if you go to our website, which is www.cancersupportteam.org, there is a tab at the top that says volunteer, and you can, or ways to get involved and volunteer, and you can click on that, and it will give you a form to send to us, and then we would call you. And there's a bit of an application process just in terms of what you want to do and making sure we explain what our services are and that you're working with cancer patients and the sensitivities. But we have a wonderful, wonderful cadre of volunteer drivers, and we are always looking for more because, as you can imagine, the need is huge.
Exactly, yeah, exactly. There was only a couple of times, which was out of all the time, that whole year, that they wasn't able to do it, and it was very, very rare, but there was always drivers available too. So I implore, anyone who's out there, please, volunteer or even donate.
Yes.
And how can they donate to the organization?
Again, if you go to our website, there right next to the volunteer button is the donate button.
Okay.
So either one is great.
Right.
And obviously, as our services are all free and we don't bill insurance, we do rely on generosity of our funders, grantors, and individuals.
Lovely. And so I have to say that even when my dad was in hospital towards the end, that Ailish did come to the hospital to see him. And so that was because my dad has so much love for her, so that was very, very important that he saw her, and he was like so happy when she came, his arms open up,
Well, what we do is, we will visit with patients in the home. We are a home care agency, but we visit in the home and in the community, meaning hospitals, hospice, nursing homes. But we'll meet, if a patient is working and can't get away, we'll meet them at a Starbucks or in the lunchroom or their office, wherever they're comfortable, or that they can come to us, or we can speak to them on the phone as well. And it really is it's the connection and providing support in however we can.
Right. Did you give the phone number also, if you could give the phone number?
The phone number is 914-777-2777. Lots of sevens.
Well, there you go, easy to remember, right?
Yes.
Okay, so now, is there anything else that you would like to share about the background of a cancer support team?
I just think we just want everyone to know that we're there for you no matter where you fall on the socioeconomic ladder. We are completely free. We do not bill insurance, so you need to have a primary care or an oncology doctor. But as long as your primary diagnosis is cancer and you live in Lower Westchester County is our niche. However, we do work with patients in Northern Westchester County, and longer term our goal is to expand. But the primary focus is Lower Westchester County. We just want people to really know we're here to help in any way we can. And with all the services, our case management program has grown exponentially since I joined. And case management means we're helping patients with receive benefits, helping them navigate the insurance process, even if they're fully insured and have all that they need. As Lucia Winton, our Director of Patient Services, likes to say, anyone with a cancer diagnosis is medically underserved because you're facing just a huge stack of bills and wading through all of those and trying to figure out what resources are out there. You know, like we have the transportation program, and you said you were probably struggling and figuring, how am I going to get my dad there?
Right.
And fortunately, a lot of the hospitals and medical centers and doctors we work very closely with, and they refer to us all the time.
Excellent.
But there are, there are so many other resources out there, and our case managers and our nurses are aware of so many. We've helped get meals into the home for people. We've helped with childcare. We've helped finding camps for kids to go to. It's great. And we also, I will show you this.
Yes, okay.
Have I don't know where to put this, but
that's
we have a resource book that we have in English and in Spanish, and this is a book of local, regional, and national resources available for cancer patients. And it's very user-friendly. We give this to every new patient, and it's a great, great resource guide.
Do you have other resources there that you want to share?
Well, we have it in Spanish.
Okay, great.
And then I brought our brochure. Unfortunately, I thought I picked up English and Spanish, but they're both in Spanish.
That's okay.
So this is part of the welcome packet for the patients, and we just want everyone to know we're there for them to help them.
And so now there's what is, for some reason it's slipped me, the big umbrella of cancer societies.
The American Cancer Society.
American Cancer Society. Do you have any connection with them?
They refer to us. And they also have a driver program. I don't think it's as active as ours is.
No,
so we may go back and forth with some of the rides, but no, we are a completely standalone entity, and we're not affiliated with another organization. So we are our own little group.
That's interesting.
But our group of, as I said, we have 6 nurses, 3 case managers, 2 social workers. Last year we served 781 patients.
Wow.
So
you do have a big caseload,
do a lot with who we have.
And then how many nurses do you have?
6 nurses. So, and some of them, we have 2 full-time and the rest are part-time. And they're all they're absolute angels.
Right.
And one thing that you had mentioned that I thought would be interesting, or maybe that you would like to know, is when we have a weekly team meeting. And our team meeting, we start off talking about patient deaths. And it is a great opportunity for our staff to tell the story of the patient they worked with. And for those of us who aren't, I remember your dad, both for when you were away and coordinating that, and then also when he did the picture for the newspaper.
Yes, he did that.
But it's great for our nurses to be able to, in essence, eulogize patient, but really make them, and you can tell from that how deep the relationship becomes between our clinical staff and our patients.
Sure. Because I remember even like the protein shakes, like she had bought these, the Scandi
shakes. Yes.
Yeah, so
those
even that was like, it's like every fine detail was covered. And I know that my dad would have been one that would say, no, I don't want them to know. But it was important for me to share about this organization, what it was that he had, and how he lived a very full life in that whole year, that there was no pain, there was no agony, there was no stress. It was just that he just lived. And through that whole year, we went all over the place. We went upstate numerous times. I took him to the horse racing. He loved the horse racing. And so we lived, and everybody would look at him and say, he has cancer, he has lung cancer. And I'm like, yes, they couldn't believe it. Yeah. And like at the end, there was no pain. And so I wanted to share that because I think it's important. And how would I share that without talking about my dad? And it can just save somebody else that when they see certain things in their body or some shifts happening, that they should really get themselves checked out, especially for family members.
Absolutely.
Because sometimes these things are hereditary, and so it's important to share. And even though I know he was one for being very quiet and not wanting to know anything, but it was important. Dad, it was important.
That's wonderful.
So we're winding down, and so if there's anything else that you would like to share about the organization.
I just want to thank you first for having me here and allowing us to tell our story.
Yes.
We are very fortunate. We have wonderful volunteers, wonderful board support, wonderful grantors. We just I was just last weekend at a Swim Across America and Long Island Sound event. They're one of our big supporters. We're one of their beneficiaries. And there's a Long Island Sound swim this weekend. So we're very grateful to them and all of our other funders. And just, I hope people will know that we're here and we're here to help in any way we can, whenever they need.
And again, I will say or stress it that people should really take the time to do some volunteering and to donate to a very special cause like this, because cancer is becoming very, very prevalent throughout, and you know, you see it all over the place, young, old, it's afflicting everybody, and so it's just having that care through that time, and it's just not going into the thing like, oh, he's going to be around forever or whatever. No, just to making it comfort. So that's what Cancer Support Team did. They made it very comfortable, smooth transition. I mean, I never felt any kind of stress with worrying about him getting to here and getting to there. And I mean, I've got my own inner strength, but you know, the worldly strength, worldly stress, I should say.
That is one of our goals. Our mission is to enhance the quality of life of patients and families living with cancer. And one of our big objectives is to decrease the anxiety and stress by providing the support and the information and the resources.
Right. Oh, and Julie, I'm really glad that you came. And I know when we spoke, I said it was very important for me to get this story out, because it's a wonderful story. It's a wonderful organization. And whatever I can do to support in any way, please let me know.
Well, thank you
and
very
I would
much.
love to come, and I don't know if I'll be around, you know, like meet the volunteers and thank them personally, and just to thank Cancer Support Team for everything that they've done for me and my dad, you know, and the time that
Thank you for sharing your father with us.
Oh, I didn't even mention that, you know, Ayla, she came to the funeral. She was there also. It's like from the moment we made that connection, Ailish was there. Cancer Support Team was there. And so what else do you have out there, you know, like that? So anyway, thank you, Julie.
Thank you for having me.
And so again, this is in memory of my dad, Victor Graves, who transitioned May 19th. And so your level of consciousness is the gateway to the future. Thank you.